Welcome to Nexus Medical Media. In this video, we are going to talk about surgical site infections. We are going to do this in two videos. So this is part one. Make sure you watch part two, which is just in the description box. And also there is a link on the top right corner to watch the part two. So what is a surgical site infection? This is an infection related to a surgical procedure that occurs on or near the surgical site within 30 days after the surgery, or up to 90 days, that's 3 months, following surgery when an implant or a prosthetic is used, right? So without an implant, if it occurs within 30 days, we call it a surgical site infection. And if you're using a prosthetic, occurs within 3 months or 90 days, we call it a surgical site infection. I didn't find much data here in Zimbabwe, but I found studies which were related to surgical site infections after cesarean section. I'm sure you did that in obstetrics and gynecology, so just go through literature review. But in those different studies, what I realized is that surgical site infections are the most common reasons for unplanned readmission after a surgery. And the incidence of surgical site infections varies widely, ranging from 5 to 30%, depending upon the operative site and wound classification. Alright, so I said I need active learners on this channel, so I want you to do something for me. I want you to discuss or just write down the implications of surgical site infections to the patient, to the healthcare staff, that's nurses and doctors, and to the healthcare institution, or like the healthcare of the country at large, right? So if you understand this, you understand why this is a very important topic for you to master, right? So let's proceed. Now let's talk about a classification of surgical site infections. There are two classifications I am going to talk about. The first one is according to the depth, right? So there are three: the superficial incisional surgical site infection, deep incisional surgical site infection, then there is organ or space surgical site infection, right? So superficial surgical site infections, these will involve the skin and subcutaneous tissue, right? Skin and subcutaneous tissue. If it's deep, we're talking about the muscles and fascia, that's deep soft tissue. If we talk about organ space, it's basically organ or space, like we're talking about the actual organs, right? So according to depth, superficial, deep, organ or space. The second classification, well, this is actually based on the degree of contamination of a surgical wound at the time of operation, and this is according to the National Healthcare Safety Network. All right, so this classification is also more like, we can call it, is a risk factor for surgical site infections, right? The degree of contamination is a risk factor, as you are going to see later in the second part, in part two. According to the level of contamination, we have 4 classes, right? We have clean wounds, clean contaminated, and dirty infected, which are class 1, class 2, class 3, and class 4. And here I just brought in the description, some examples, and the risk of infection, the percentage risk. Let's start from the clean wounds, the class 1, right? So these are uninfected operative wounds in which no inflammation is encountered. The most important thing you need to know about this class is there is no, we are not breaching the genitourinary, the respiratory, or gastrointestinal tract, that is intact. So examples of class 1 wounds, these are like in breast biopsy, or mastectomy, a hernia repair, thyroidectomy, right? And the risk of infection is about 1 to 2%. Next, clean contaminated, or class 2. In this case, this is an operative wound in which the respiratory, alimentary, genital, or urinary tract are entered under controlled conditions and without unusual contamination, right? So we have breached that, but it's controlled. And examples are biliary tract surgeries like laparoscopic cholecystectomy, appendectomy, hysterectomy, operations of the oropharynx, right? And the risk of infection for clean contaminated is about 5 to 8%. I saw another literature which was saying 8 to 10, right? But just to get that one, 5 to 8%. In most cases, it will be correct. Contaminated wounds, that's class 3. So in this case, the whole viscus is perforated and there is gross spillage from GIT. Some will call it like controlled spillage, right? And the examples of class 3 are all colonic operations, open fractures, traumatic wounds, and the risk of infection is about 15 to 20%. Dirty infected wounds, or class 4, we are talking about wounds with retained devitalized tissues. Examples are abscess drainage, if someone has peritonitis, empyema thoracis, and this is actually the worst in terms of a risk of infection. It's 40 to 70%, and as you can see in red, that's the same source, 12 to 20% in class 3 and over 25% in class 4. Thank you so much. I hope you found this video helpful, and if so, make sure you subscribe, share with your friends, and leave a comment in the comment section. Please make sure you watch the next video, which is part 2 of surgical site infection. Thank you.